Okay, we're going to get started. Good morning, good afternoon, depending on where you're at in the US or internationally. It's a pleasure to be here. My name is Michael Méndez. I'm an assistant professor of urban and environmental planning at the University of California, Irvine. And I'm the pleasure to be the moderator and one of the co-authors for this webinar on queer and present danger, understanding the disparate impacts of disasters on LGBTQ+ communities. Today, we will hear presentations from both disaster studies experts and policymakers on approaches to safeguard socially vulnerable populations. Our webinar will explicitly discuss risk and impacts to queer people. We will examine case studies and policies in which stakeholders are proactively collaborating to develop new strategies in the context of disaster and queer inequality. We will further analyze how to create an inclusive process of disaster and climate adaptation planning. First off, I'd like to thank our sponsors. First and foremost, the Association of Collegiate Schools of Planning, the special interest group called Inclusion, and LGBTQ allies. So this special interest group, Inclusion, is part of a growing group of faculty members as well as practitioners throughout the United States that are focusing on how our field of urban planning is addressing or not addressing issues of LGBTQ communities. Also like to thank our other sponsors, the University of California, Irvine, the School of Social Ecology, the UCI Center for Medical Humanities. And a special thank you to the UCI Social Ecology Communications Office, and in particular, Mimi Cruz. I think it's important to take a moment to reflect on the significance of this webinar. This is the launch of ACSP's Inclusion fireside chats that are going to underscore the need for more research and practice on important urban planning issues impacting LGBTQ+ communities in the United States and globally. We will have two more events, fireside chats in the year 2022, and we hope you can also attend those. Moreover, this webinar today is also a historic convening. This is one of the first times that the nation's top disaster organization, the Federal Emergency Management Agency, or FEMA, is explicitly participating in a forum that pertains to queer people and environmental impacts. While the risk and impacts of climate-induced disasters to the queer communities are not well understood in the public policy arena, we anticipate that this webinar will provide additional resources to further incorporate queer issues in climate adaptation and disaster planning efforts. So thank you for this opportunity to join this important meeting. Today, we will hear from several queer climate change experts, scholars, and policymakers who all happen to identify as LGBTQ. But before we hear from our speakers, I would like to provide a brief context about queer-focused disaster planning for this webinar. The 2018 National Climate Assessment estimates that climate-induced disasters such as hurricanes, wildfires, and flooding are expected to become more frequent and severe as the climate changes. Members of the queer communities are often excluded from government and private disaster relief efforts and disaster recovery efforts as well. Queer individuals are uniquely vulnerable to climate-induced disasters because of intersecting impacts of social stigma, discrimination, including race-based and poverty. Marginalization of the queer community extends to disaster preparedness and response in several ways. According to Dale Donnelly Halls and co-authors in the journal Gender, Place, and Culture, queer people are often not considered in evacuation and emergency shelter procedures and find it more challenging to find new housing and employment associated with disaster recovery efforts. Emergency shelters in particular are often not able to serve queer disaster victims. In one reported case during the Hurricane Katrina, a trans woman who was jailed after showering in a women's restroom. This was despite the fact that this was permitted by disaster shelter volunteers. After disasters, moreover, the queer community also faces heightened hostility following media reports about US white ring religious groups who assert that disasters are divine retribution for those who sin and those who support them. We also often talk about how the field of environmental science and studies has racist origins. such as the deep ecology movement of the 1980s and the 1990s. Yet we must also acknowledge that this movement, including mainstream environmental groups, have had a long history of homophobic connections to the environmental field as well. For example, the deep ecology movement really put forward this idea that AIDS was the answer to the environmentalist prayer, and saying that this plague that was happening to the LGBT community was good for the environment. And one of the leaders of the deep ecology movement was quoted in one of these articles saying, quote, "Basically, the aim of my article was to point out that the AIDS epidemic, rather than being a scourge, is a welcome development and inevitable reduction of the human population. Welcome because unlike nuclear war, mass starvation, or ecological catastrophe, the disease only affects humanity. And it therefore holds out the possibility of decreasing human population to a level compatible with an intact biosphere," end quote. To overcome this dark history of our environmental practice, today we will highlight how governments often overlook the needs of queer people, in particular low-income people of color and transgender communities. Our research adapts the work in the fields of public health and ecofeminist studies that examines issues of intersectionality. That is, how social categories of identity and culture intersect to reveal how new patterns of environmental risk and injustice unfold in practice. For this webinar, we analyze the intersection of race, gender, sexuality, class, and immigration status. We achieve this through analyzing the methods in which queer environmental groups are collaborating on disaster and climate adaptation planning initiatives. These community groups ask a fundamental question: what does adaptive capacity and climate adaptation or disaster policy mean to queer communities in terms of queer youths, queer seniors, queer couples and families, transgender people, queer people of color, queer undocumented migrants? So in sum, today we will explore these questions through two new studies that were just released. Following those presentations, Justin Knighton with the FEMA, the Federal Emergency Management Agency, will provide a response. So thank you for this opportunity to provide this brief framing lecture about our webinar. Next, I'm going to be introducing our first two panelists who will be presenting our co-author research on queer and present danger. First is Leo Goldsmith. He is a climate and health specialist with the ICF, a global consulting environmental firm. He helps coordinate the interagency cross-cutting group of climate change and human health. He facilitates the implementation and integration of health activities and it's one of the main point persons for the U.S. Global Research Change Program's National Climate Assessment number 5. Vanessa Raditz is the co-founder of the Queer Eco Justice Project and is also a PhD graduate researcher in geography at the University of Georgia. They are an educator, facilitator, and organizer working at the intersection of ecological justice, LGBT rights, arts and media, and community health. They are passionate about working with organizations to help empower and support community movements for healing, ecology, and justice. And finally, prior to pursuing their doctoral studies, they served as the Citizen Science Coordinator at the University of California Cooperative Research Extension Program. So with that, I'll hand it over to Leo and Vanessa to talk about the research.
Thank you so much, Mike, for the wonderful introductions, for providing that context, for coordinating this webinar, and for your critical contribution to this paper as a co-author that I will be presenting on today with another co-author, Vanessa Raditz. And while you get that on view, Vanessa, I will just say that our paper is titled Queer and Present Danger, Understanding the Disparate Impacts of Disasters on LGBTQ+ Communities. So this paper has been accepted and peer reviewed in the Disasters Journal, and you can find a link to it in the chat. And so to open and frame the context of this discussion, I want to ground us in the climate emergency that we are facing today. Next. The slide that you see here depicts Houston, Texas after Hurricane Harvey. Every person in this picture, every person who has experienced this disaster and other similar extreme events across the United States have faced negative emotional, physical, and mental health impacts. Despite everyone being affected by extreme events, marginalized communities face the greatest risk to impacts from disasters due to compounding effects of systemic discrimination, leading to poorer health, economic, and social outcomes. Next. The Forest National Climate Assessment, published in 2018, stated that climate change is causing extreme events to become more extreme, more frequent, and will disproportionately impact vulnerable populations. Until FEMA published their 2020 National Preparedness Report in December of 2020, no US disaster literature identified LGBTQ+ communities as a vulnerable population in the context of disasters. And that's where our paper comes in to fill in that gap. Next. For our research, we used peer-reviewed articles focused on disaster impacts on sexual and gender minorities internationally, along with a couple of domestic articles on Hurricane Katrina. We also used urban planning literature focused on the exclusion of LGBTQ+ communities from certain neighborhoods, and also reports and guides from US-based LGBTQ+ organizations. Next.
And what this literature points to is two things. First, the vulnerability of queer and trans people to climate disasters, and second, the invisibility of this vulnerability in society and the media. Part of this invisibility is due to LGBTQ+ people closeting their identities for fear of violence. As you heard from Mike in the early framing, in fact, as the climate crisis intensifies, LGBTQ+ people may face even greater threats as social instability and resource scarcity increase homophobia and other forms of violence. According to religious scholar Crystal Clayville, the instability of nature and the frequency of deadly storms are understood in fundamentalist Christianity as not caused by, quote, carbon consumption, but by sexual immorality, end quote. This can be seen in this quote from media pundit Ann Coulter in the aftermath of Hurricane Harvey. But there is a really long history to this kind of message. For thousands of years, the Christian church has called LGBTQ+ people unnatural and crimes against nature. The academic field of queer ecologies has analyzed the use of this word nature in this rhetoric, revealing the social construction of cis heteronormativity, which we often think of as natural, but is indeed created through social processes amongst both humans and non-human animals. They instead point to the science of biological exuberance, which describes the vast diversity of gender and sexual expressions and embodiments in the living world. Queer ecology scholars further argue that the exploitation of nature and the marginalized social groups are linked. And they call for the inclusion of LGBTQ+ issues in environmental agendas and research. We also draw upon critical environmental justice studies, which emerges from the environmental justice literature that has long demonstrated that race and class impact a community's exposure to environmental harms, such as air pollution, and their access to the resources for resilience, such as nutritious food. Critical environmental justice studies adds an intersectional approach to emphasize how multiple systems of marginalization interact. Drawing on this theory of intersectionality developed within Black feminist thought, we describe how LGBTQ+ individuals who are additionally marginalized by racism, classism, sexism, ableism, immigration status, and more will experience compounded negative impacts from disasters. Historical and ongoing processes of stigma, violence, and discrimination have created social disparities in the everyday lives of LGBTQ+ people that can be exacerbated during disasters. Yet these existing disparities are generally obscured by the myth of gay affluence in contemporary American culture, in which LGBTQ+ representations are generally reduced to, quoting DeFilippis 2016, fashionably sophisticated white gay men with an abundance of disposable income, end quote. It is imperative that disaster scholars and practitioners understand and recognize LGBTQ+ poverty and disparities, especially for LGBTQ+ people of color. We refer to these as contextual vulnerabilities, economic, political, and social inequalities that exist within LGBTQ+ communities before disasters occur. For instance, LGBTQ plus people are more likely to be impoverished, homeless, diagnosed with a mental illness, with a chronic illness, unable to access healthcare, and incarcerated. In our paper, we address each of these contextual inequalities in detail and how they contribute to vulnerability during disasters. But for now, I will highlight just a couple brief, quick facts on each one. Starting with poverty. In a 2018 study, more than 1 in 4 LGBTQ individuals experienced a period over the prior year where they could not feed themselves or their family. And the US Transgender Survey found that transgender respondents had double the overall US adult poverty rate. For homelessness, this is particularly seen within homeless youth, where while LGBTQ plus youth make up only 10% of the national youth population, they represent as much as 40% of homeless youth. One way of measuring serious mental illness is suicide, which is around 10 times higher in LGBTQ plus communities and is particularly impacting transgender communities. When it comes to chronic illness, the most well-known epidemic in LGBTQ plus communities is HIV, but disparities in physical health go far beyond sexual health. The Institute of Medicine's 2011 report, The Health of Lesbian, Gay, Bisexual, and Transgender People, reviewed all existing literature to date, showing disparities in wide-ranging conditions, including cardiovascular disease, respiratory disease, cancer, and lower rates of what they call overall health. Some of this is related to the lack of access to healthcare, which is particularly due to lower rates of health insurance coverage, which is, again, even lower among LGBTQ people of color and transgender people. Lastly, let's look at incarceration. LGBTQ plus people are incarcerated at 3 times the rate of the general population. Amongst Black trans women, nearly half of all respondents had been incarcerated at some point in their lives. These high rates of incarceration are often the result of discriminatory policing and surveillance, and they also stem indirectly from the higher rates of poverty, homelessness, and mental and physical disabilities reviewed above. Overall, there is a need when we're thinking about disaster planning to focus on the most vulnerable within these communities, who are Black and Indigenous people of color, elderly, youth, transgender, undocumented, and disabled. To conclude this section on framing, there are many reasons that invisibility is heightened during a disaster as LGBTQ people do what they can to mask their identities because of the fear of discrimination. Nevertheless, LGBTQ plus populations should be considered as a component of every community that is already vulnerable. Different LGBTQ plus communities will have different needs. This review article provides insight into the unique disaster planning needs of many of these communities, but cannot be comprehensive. Learning to see LGBTQ plus people within climate vulnerable communities is critical for planning for their survival. As philosopher Kim Hall puts it elegantly, whether or not one survived Hurricane Katrina was not simply the result of living below or above sea level. It was also about being taken into account in the city's planning for the future, being thought of as someone to consider in light of possible disasters. Back to you, Leo.
Thank you. In this next section, I will be providing a high-level overview of the drivers of discrimination and bias in disaster for LGBTQ+ communities. The first of which I will talk about is inequitable government disaster response programs. The Department of Housing and Urban Development, which FEMA sits under, has a couple of non-discrimination protections that can either be interpreted in a discriminatory way or reversed depending on the administration that is in office at the time. Despite the fact that LGBTQ+ individuals currently cannot legally be turned away from federal funded temporary emergency shelters during disasters, they can still be discriminated against by staff, other residents who are using the shelters, and those shelters may lack access to critical medications that are needed at a higher rate within LGBTQ+ communities, such as HIV medicines, hormones, and medications for chronic illnesses. Black and Indigenous people of color and transgender individuals are always hit the hardest. In one case, which was alluded to earlier, 2 Black trans women were arrested for using the bathroom of their gender at a temporary emergency shelter in Texas after Hurricane Katrina. Next. Another driver of discrimination is a lack of recognition for LGBTQ+ families. LGBTQ+ families can be defined as genetic or legal, but also chosen family as well. A chosen family is a group of important people that make up some social support system that is just as valid as genetic or legal family. Historically, disaster response and relief policies did not acknowledge same-gender couples and still do not acknowledge chosen family. LGBTQ+ individuals, couples, and families have therefore had to lie in order to receive disaster relief and aid, and many families have been separated either from their partners or their children without any way to contact them or know where they are. In 2 reported cases, LGBTQ+ couples had to pose as sisters to prevent separation at a shelter or in order to receive relief benefits for themselves and their children. Next. The final driver I'll be talking about today is focused on faith-based organizations. LGBTQ+ individuals are often discriminated against on the basis of faith and religion. LGBTQ+ communities have often been blamed for disasters and public health crises throughout history by some religious figures and some religious politicians, with an example told earlier in the presentation of a quote by Ann Coulter. However, faith-based organizations are the first responders during disasters before state and government response and relief kicks in. In many cases, faith-based organizations have refused to provide service to LGBTQ+ communities during disasters. And even if those organizations are LGBTQ+ friendly, the historical legacy leaves some LGBTQ+ individuals wary of seeking help in faith-based organizations. Next. So now that I've talked about the drivers, I'll lay out some recommendations from our paper. Disaster relief organizations, local, state, and federal government, and entities receiving government disaster funding, as well as health organizations, should all receive ongoing cultural competency training on sexual orientation and gender identity. They should also all have anti-discrimination policies created that explicitly protects those on the basis of sexual orientation and gender identity, and should be drafted with LGBTQ+ communities. These same entities should update their disaster and emergency plans with LGBTQ+ specific language and should consult LGBTQ+ communities for these plans. Next. There should also be funding for organizations that work with LGBTQ+ communities to provide disaster response assistance, and funding for LGBTQ+ community centers to be trained in disaster response and also consulted on making renovations needed to qualify as a state or federal emergency shelter. Next. Government should also establish permanent disaster relief funds that are culturally and structurally sensitive to LGBTQ+ people and other marginalized communities. They should also facilitate relationships with foundations and disaster relief organizations to provide targeted funding to LGBTQ+ communities. Next. And finally, there should also be healthcare for the uninsured and those who are undocumented. States should provide funding for access to healthcare and mental health services to prevent exacerbating existing health disparities within this community that is only made worse by disasters. Next.
Thank you. And so to conclude, I would like to return to our story of Hurricane Harvey at the beginning of this presentation and emphasize that this is not only a story of LGBTQ+ vulnerability, but also one of resilience. In the aftermath of Harvey, the Montrose Center in Houston raised over $1 million to provide direct support to the over 35,000 people served by their core programs. And they collaborated with other groups, such as Organización Latina de Trans en Texas, who provided emergency shelter to trans Latinas, including those who are undocumented. The queer disaster literature highlights that throughout histories of marginalization, LGBTQ+ communities have crafted collective strategies for resistance and resilience in the face of pervasive structural oppressions. And these strategies are important resources during times of disaster. LGBTQ+ resource centers are part of that history of resilience. And as Gorman Murray et al. Clarify, acknowledging the resilience of a community, quote, certainly does not mean that a given social group or community should be left to its own devices in and through policy and planning. Capacity is inhibited by structural constraints and can be enabled and enhanced by the provision of resources by governments, authorities, and organizations. It is for this reason that we emphasize partnering with LGBTQ+ communities to enhance their capacity for resilience through policy and socioeconomic resources. We hope that you will take away these main points from today's presentation. During planning, LGBTQ+ people should be considered as part of every community already identified as vulnerable to disasters. And LGBTQ+ members of impacted communities experience unique vulnerabilities because of the inequities in government disaster response programs, lack of recognition of LGBTQ+ families, and the prevalence of faith-based organizations in disaster response. Local and state governments can take leadership in planning for intersectional disaster preparedness and response while encouraging federal responses and funding. And we encourage planners to focus on identifying and enhancing existing resilience in LGBTQ+ communities by partnering with LGBTQ+ organizations and funding their own community-based planning and response. So to conclude, as disasters increase in frequency and severity due to climate change, investing in community resilience is essential to help the most marginalized populations bounce back from injustice, and also to help all of us as a society follow their leadership to bounce forward to more equitable and just futures.
As we come to a close for this presentation, I just want to say thank you all to those who are attending for being here today and for your interest in this topic. I want to say thank you again to Michael Méndez for coordinating this webinar and for your critical contributions to this paper as a co-author. And I also want to say thank you to Kevin Blanchard and Justin Knighton for joining us in this critical conversation today. And we look forward to the Q&A shortly. Thank you.
Great, thank you, Leah and Vanessa, for that very informative presentation on the contextual vulnerabilities of the LGBT communities, as well as pushing back against the myth of gay affluence, or that LGBT communities are only urban in nature, but they exist in both urban and rural settings, and we need to have special consideration in disaster planning. So next up, I have the pleasure of introducing Kevin Blanchard, who's going to provide an international perspective of disaster planning in LGBT communities throughout the world, and his unique contributions to the United Nations disaster risk reduction programs. Kevin is the director of DRR Dynamics, which is a UK-based organization focused on ensuring the inclusion and empowerment of marginalized groups in disaster risk reduction, or DRR. Kevin has over 14 years of experience in developing inclusive DRR and humanitarian policies for national governments, international agencies, and NGOs. And he'll be speaking about a new policy report that he just released last month, and I believe a second one that he'll be launching shortly. So thank you for this opportunity, Kevin.
Thank you. Thanks, Mike. Just going to share my screen just very quickly. Excuse me. So yes, thank you, everyone. My name is Kevin Blanchard, and I'm going to be speaking to you today about LGBT people and disasters from an international perspective. So as you'll see, I have quite a few slides to get through, so I'm going to kind of whiz through the overview. However, if you do have any questions or kind of want to dig down further, as others have said, there will be a Q&A at the end that we can talk about. I want to talk briefly about the report and highlighting the current situation for LGBT people in disaster risk reduction policy on a global basis, what needs to change to build a more inclusive disaster risk reduction system, and provide some recommendations for us as practitioners, policymakers, and academics on how we can build an LGBTQI+ process, and then also some next steps on how to get involved. So DRR Dynamics, as Michael very quickly mentioned, based in the UK, formed in 2014, we have primary goal of ensuring marginalised groups are better included within disaster risk reduction policy practice management, and we do that through outreach and engagement with communities that are impacted, but also through engaging with, excuse me, engaging with governments, international organisations, etc. So the report itself was co-authored by myself and my colleague Holly, who is actually on the webinar today. And we started this piece of work back in the early part of 2021, really to understand what the global view was in terms of LGBTQ plus inclusion within disaster-related policy and practice. And we did a country by country analysis of any and all disaster risk reduction, disaster risk management, emergency management, policy, strategy, legislation, etc. And we tried to explore where gender and sexual minorities were included within that. So that was a kind of the initial data collection, and then Holly and I really decided that actually this was such interesting data. It had such potential for engaging and a meaningful discussion that we decided to produce a report trying to provide some guidance and some policy guidance on how organizations, how national governments, etc., can build a more inclusive disaster risk reduction policy. Before I go into the report in some detail, I just want to kind of give you a very high level framing of where this started. So the Sendai framework, for those who don't know, is a global framework formed through the United Nations Office for Disaster Risk Reduction, or UNDRR, that really tries to galvanize a global response to reducing risk to disasters. It was adopted back in 2015 in Sendai, Japan, hence the name. And it does aim, it has quite lofty ambitions in that it does aim to produce a more inclusive disaster risk reduction process. And it does include a number of marginalized groups specifically within the text and the literature of that framework. So it talks about women and girls as a marginalized group, older people, those with disabilities, indigenous populations, etc. And it talks about how we need to engage with these communities, how we need to collect data with these communities in mind, be able to disaggregate that data, etc. There are a number of kind of key points of this framework that allow that to happen. However, Sendai does unfortunately also exclude a number of more marginalized or hyper-marginalized groups, including LGBTQI plus people. And I think it's probably fair to say that, without this kind of leadership from an international level, without the Sendai framework specifically calling for engagement with queer communities, with trans communities, with communities of color, particularly of LGBTQI plus, there is no emphasis, or there's no kind of reason for national governments at a national level or even a local level to actually start to build that into their own policy making. And that's something we've started to see through our research. And the lack of specific focus means that those countries who have adopted the Sendai framework as a platform to reduce disaster risk really only need to adhere to a number of marginalized groups to ensure that they're maintaining the Sendai framework. So the resulting research that both myself and Holly carried out, we found that actually only 6 countries on a global basis had any mention of gender or sexual minorities within their policies related to disasters or emergencies. And of those 6, only 2 were official government policy. The rest were in arm's length bodies or were in academic institutions that had government funding that was kind of feeding into a policy development process. So it's a very limited scope on a global basis of countries that had given some consideration to the idea that LGBTQI plus people might have different vulnerabilities, might have different capacities, knowledge, experience that could help build a fuller and more inclusive process for all. The kind of resulting research from this particular paper led to a number of recommendations that I'll just quickly go through now, because I realize we're kind of cutting short on time already. So we had a number of recommendations, and these recommendations are, as I said, kind of formed as a global kind of set of recommendations. They are for governments from both the global south, but also the global north, to really try to start a discussion on how to engage with these particular communities and how to build policy that serves these communities in a way that's sensitive, but also recognizes their capacities and their abilities to contribute to the overall process. And it should be said, I think this was said in Leo's and discussion earlier, we had, inclusion shouldn't be a tick box exercise. It shouldn't just be done because it looks good on your final report or it looks good on a tick box sheet. It really does need to be implemented with a long-term committed strategy to ensure that these steps are taken to the best use of your time and that particular policy process. So the first was, and again, this is kind of quite repeating some of the points made in the previous discussion, engagement. Really engaging with communities is really the best way to develop a policy process that enables this this discussion to happen and for this policy to be developed in an inclusive way. And one point, we really did find through the work of our research was, queer communities of colour are especially vital in this process, engaging with queer communities of colour, allowing a safe space for that discussion to happen, particularly with queer community colour, youth is incredibly important and should not be underestimated. But we also found that through interviewing a number of organizations around the world, that although there's this common saying that top down is bad, bottom up is good in terms of governance and in terms of kind of policy making, actually what we were seeing was a number of these small organizations based around the world were actually calling for this kind of national policy guidance to allow them to do this, to allow them to start to implement this work and receive funding being the kind of the key point there. But also give, national governments should allow local and grassroots organizations the space and the room to develop, the guidance that was provided at a national level to ensure, specific cultural, social, economic realities of queer communities within those particular countries are recognized. And then, it's not surprising to anyone on this call, we need more research. We need more evidence to show how queer people are impacted by disasters, how they're able to respond to disasters, the capacities and the knowledge that they bring to a disaster response, really to drive home this message. And this importantly needs to be funded. We cannot put extra responsibility and pressure on, particularly on grassroots and local organizations without additional funding, because, unfortunately, these organizations are often running on a shoestring budget as it is. And this has kind of led on to a wider debate around, what can we do to kind of get this recognized at an international level? And we have started just recently working with the United Nations and a number of other international organizations trying to develop that and trying to kind of build out that approach. And we've got some really exciting announcements coming up very shortly. And very quickly, if you wanted to join us in this discussion, if you wanted to join us in this approach of building a queer positive, LGBTQI+ positive disaster risk reduction and emergency management experience, we do have a Google group that you're able to join. The link's just there on the thing. So thank you very much. I've been Kevin Blanchard, and I'm very much looking forward to taking any questions you have at the end of the discussion. Thank you.
Great. Thank you so much, Kevin. That was so insightful. If anyone's interested in Kevin and Holly's report, Holly just put in the chat a link to their very informative report, and you can follow them for the next report they're going to be doing on this issue. I wanted you on this panel because of that international global perspective that you're doing, not only providing the research and evidence, but more so also pushing for social change and action at these global institutions like the United Nations that are also influencing our national governments. So with that, we're going to be speaking about a U.S. national perspective. We have Justin Knighton with the Federal Emergency Management Agency, or FEMA, as many of you know it. He's the director for the Office of External Affairs. He is a public affairs and communications strategist, storyteller, and advocate for work, and works to advance social justice, inclusion, and human rights. With a career based on a cross-sector experience and having served as a mayoral, gubernatorial, and currently as a presidential appointee, he's having a significant influence in the disaster field. At FEMA, Justin directs several teams designed to engage external partners and carry the narrative of the agency, some of which include communications, public affairs, intergovernmental affairs, and congressional affairs. Previously, Justin had served in several positions across California Governor Gavin Newsom's administration, how I came to know him, including Director of Strategic Communications and External Affairs at the California Volunteers, and also the Office of the Governor as Assistant Deputy Director at the California Governor's Office of Emergency Services, or CalOES. Most notably, Justin served as co-chair at Governor Newsom's $50 million Listos California campaign, a groundbreaking effort to boost disaster resilience among the state's most hard to reach and socially vulnerable populations. So again, we're quite honored to have Justin here representing FEMA. And as I mentioned earlier, this is sort of a historic moment. This is one of the first times that FEMA has engaged in a webinar or event that's explicitly targeted to the LGBT community in terms of environmental injustice and disaster planning.
Well, it is me who has the honor to be at this agency, to be representing the work that we're doing in this sector with this group. Hearing the research here, having looked at it previously, and just being in awe of the analysis and in awe of all the researchers who are at the table here, and just really grateful to be in this space. We have a lot of work to do in our field, in our sector. We need research, and we need your minds, your hearts, your ideas, and the analysis that you bring to our world to be able to do that. And I haven't been able to ever advance change or make any kind of needle move, large or small, if it wasn't for the academic community and analysis that looks at themes and trends and all the things that you do. And so I'm just so grateful that you've focused on the LGBTQIA community, as well as all the other connecting factors that make members of our community more vulnerable than others. And so, first of all, thank you for your work. Thank you for this conversation, and thank you for inviting me. And then thank you to all. I think at the height of the conversation, there was 241 of you listening. Some of that dropped off, but I think it's because people are so eager to take this great information and turn that into change, and they had to go. So I think that was a little drop off that we have there. But to the 241 of you who signed on to participate today, thank you for showing up and creating space for this topic and this work. I don't have to tell you the impact of climate change is something that we're experiencing today. In September, the Washington Post reported that nearly 1 in 3 Americans living in the country were hit by a weather specific disaster in the last 3 months. And those numbers continue to increase. And we know, those of us who come to this work with an equity focus, know that as the impacts of climate change continue to spur more and more disaster, and more of our communities continue to grapple with that hard reality, we know that the most vulnerable among us are disproportionately impacted. These are communities that I often refer to as communities that are often put out, shut out, or forgotten. And so I joined this administration to really focus my attention on these populations in this work. As Dr. Méndez mentioned, my background in disaster really gave me a front row seat at the gaps that exist, both among community and organizations, and within the structure of emergency management, right? Community organizations that I worked with, groups from farm worker organizations that work to support farm workers in the fields for members of our communities that speak Viki and Mixteco and other oral languages, to organizations that for the first time, LGBTQ organizations that for the first time had conversation within their statewide organizations to have conversation about disaster preparedness and resilience being an LGBTQ specific issue, to groups that work with other underserved communities day to day on issues of housing and healthcare and people experiencing homelessness, et cetera. And the gap that exists is that we haven't had a big conversation in our country, a specific conversation in our country to the level that we need to about not only the threat, but more importantly, what exists and what can be done about it, right? I was shocked that so many members that have been doing work in communities for decades had never heard of an emergency plan, didn't know that there was an entity called an emergency manager at the local level, barely pay attention to what local government is doing, right? There's plenty of trust issues and other barriers that exist there. And those are challenges that we need to continue to solve. But I bring that up to say that there are major gaps, among EM, from my experience at the local level, is that there are a number of organizations that have a seat at the table, but for as many organizations that have a seat at the table, there are a number of organizations, especially those that represent some of the most hardest reach populations among us, that don't, and that aren't as known or don't have the direct line of communication. And that could be an awareness challenge, that could be many other challenges. But that's all to say that those gaps and the truth that you are all uncovering, that we need to be better about how we're supporting those communities that are going to be disproportionately impacted and are already at a point where they are managing and dealing with a lot to just survive today. When something catastrophic happens and it derails them for the next 10, 20, 30 years, isn't okay. And so I come to Office of External Affairs as a member of FEMA's leadership team to help plug into the spaces and places where a lot of really great work is happening. And what's true about emergency management is that, as our Administrator Deanne Criswell says, emergency managers care at the end of the day about two things: the environment and people. So there's a lot of really good work happening here and at every level. I think now it's about being more intentional about that work, really focused on the barriers that exist, using data to understand what is true, what is documented, so that we can understand and help communicate and educate our colleagues and help bring some consensus around where change and advancements in these strategies are needed, really, take that into building into where we've already had progress this year and where we're really going into next. And so I want to share some of that with you to ground you in what we are looking at the federal level. Our Administrator, Deanne Criswell, who has instructed her leadership team, this agency, to be bold, to be innovative, and to put people first in our work, is coming in to this agency with two actions that the Biden and Harris administration advanced beginning of their administration that gives us the pathway we need for progress and impact. The first is across the federal government, we've been asked to advance equity in our work. And in January 2021, the president issued an executive order to create a government-wide initiative to promote diversity, equity, inclusion, and accessibility. This becomes our ethos in this space on how we advance our work. Some of that I'll share in a moment. And then the second, which is very related to this specific conversation, which is we've also been asked to address issues pertaining to gender identity and sexual orientation. And so agencies, including FEMA, are using that executive order to audit and review our existing policies to apply the lens of discrimination on the basis of gender identity or sexual orientation, to understand where we can factor in that interpretation into our work. And we are doing that analysis now. And we are being very intentional about that work. And I flagged it for my colleagues as I prepped this conversation, that to remind them that it's also very important to me personally. So I wanted to just give that grounding of the policy frameworks that we currently have in place. It gives us the ability to move. And we use that framework in the beginning of the year, right after they were issued in January 2021, where FEMA was tasked with helping the nation advance a large-scale national vaccination mission for the president. And that work was done explicitly through the lens of equity, in which our community vaccination centers were put into communities in partnership with locals, with a determining factor of SVI data, right? Where were communities that had high Black and Brown communities living that were disproportionately impacted by COVID because of a variety of reasons. But how could we bring that data to the table to inform our decision making, put those centers in those locations to advance equity and make sure that at the early days of the vaccination mission, that when we had limited supply of vaccines, that we were being very intentional that they were going first to those that were disproportionately impacted by the pandemic. And through the CDC mission, which many of you, depending on the communities you're in, were close to or nearby, or were tracking that momentum in the spring, we, I will say, we're very bold and outside the box. This agency, in partnership with our state partners and our and tribal nations and local governments and territories, really focused on how do we bring community to the table to have conversation, to make sure that we're being accessible in these centers, that we are thinking about the needs of community, that we are thinking about how to engage community, not through traditional means of government saying a thing to attract people, but more importantly, empowering our local community partners, the voices and people that have trust and work with community on a day-to-day basis, empowering them to help communicate what was available to them. And in some cases, we even had those partners become like hosts for the day of these centers. One of my favorite stories was how we used Vaccination Mission to actually partner more directly with organizations who had, days in which they became the host of a particular CDC and drove their populations and helped staff those centers and et cetera, et cetera. So that gives us a really strong model that may have been done in different contexts throughout the last several years at different levels of emergency through the whole life cycle of the disaster, but not all at one time on a very similar mission across the country, in which every geographic region is very different, and the needs of one community in California are vastly different than the needs of the same or similar community in Florida. To navigate all of that at the same time. And so that gives us then the framework that we then spearheaded into creating a working group on equity, of which I'm a part of, that we are tasked with actually doing the auditing and analysis of programs and policies across the agency to help advance that change and help be the support system of our colleagues, for our colleagues to look at what's possible, where change is needed, and where we need to be better and do more. The last thing I'll say of what we've done, this year that I'm particularly proud of, that we're proud of, is there was a policy that was that created a barrier for specifically Black communities and Black families in the South who have inherited homes from family members and didn't have a formal deed or documentation, sanctioned government documentation of home ownership. And so for far too long, these families were denied disaster assistance. And we worked as part of the response to Hurricane Ida this year to expand the interpretation of what we allow for showing home ownership, from signing a piece of paper and giving a sign for someone who's also looking at a bill that you're getting from in the mail for service that you pay for, and many of these other types of very loose interpretations of home ownership to make sure that assistance is getting into the hands of survivors. And I realize we're getting so short on time. And so the last thing I'll say is all of this is building more momentum for us that I want you all to be mindful of as we go into next year, because we're on the heels of releasing our strategic plan for 2022 to 2026. that will help shape and frame what Newman does next, and how we use resources, how we advance our programs and policies, and make decisions. And all of this is to frame the administrator's bold vision for how to move this agency forward. And equity is one of the 3 core pillars of that work. And will be something that I hope all of you will see and review and understand as we release that plan and start boldly and quickly executing against it, with the focus on that executive order on equity that lists out what underserved communities means, and LGBTQ people are captured in that definition. But again, it gives us a pathway to be very intentional and focused on the needs of populations. I'm going to stop there.
Thank you, Justin, so much. That was so informative. And again, we're lucky to have you in that position, somebody that understands the unique issues facing communities of color and LGBTQ communities. So thank you for that work. And we're very happy to have Biden in the administration that's reversing some of the harmful effects that not only happen to LGBT communities, but all communities that were regressive. And you have a lot of work to do to reverse some of those policies. And we were happy to see, as we mentioned in our paper in 2019, FEMA for the very first time in one of their disaster reports in 2019 mentioned LGBT communities as a socially vulnerable. It was only 1 or 2 sentences, but that was a giant step forward in acknowledging these communities, as Kevin talked about in his global research on countries that are acknowledging LGBT communities and communities in disaster planning efforts and official adopted policies. So I know we're going over, so if everyone will bear with us for maybe 5 minutes, we'll be about 5 minutes over. We do want to answer a couple questions that were put in the Q&A chat. And the first one was a basic question from Carson to the panelists. Are there any examples of emergency plans that have done a good job at the local level incorporating perspectives of LGBT communities? So if Vanessa, Kevin, Leo, and Justin can answer that question, any of them? Leo or Vanessa?
I'm waiting for other people to speak. On a global basis, I mean, there are a handful. It really is very, very disappointing reading, I'm afraid. I mean, to be fair, and this is something that we found in our research, it's mainly academic institutions who are doing the really good work. And when it comes down to kind of government level policy, we start to struggle. And the one kind of really great example I would use was an example from Ecuador that talked about, I mean, they had a paper specifically focused on gender-based violence, but they had a very clear call within that to recognize that gender-based violence can impact all types of domestic settings. It kind of looked beyond the binary, which I was really, really happy to see. And it's kind of the first example of that I've seen on a national level policy. But apart from that, no, I can't really think of any, which is incredibly disappointing and very, very sad.
Sure, Leo or Vanessa, some examples from our paper, perhaps you can mention about shelters or disaster plans in West Hollywood or other places.
Well, a couple things that I would say. There's SB 160 in California that was passed in 2019, specifically mentions LGBTQ, and this is a bill that requires cultural competency in emergency services across the state. And they specifically mention the LGBTQ community in that piece of legislation. And that bill was passed through a coalition of environmental justice groups, including LGBTQ organizations that were championing for that. I also want to point out on the topic of LGBTQ centers becoming shelters. There is precedent for that, including one that I know them personally in Oklahoma. In Tulsa, Oklahoma, the LGBTQ Center went through a large capital campaign, and when they did so, they made sure that they meet FEMA's requirements to be I believe the term is congregate emergency housing. And that included things like showers and washing machines and an industrial kitchen, which they can now use for their day homeless youth drop-in programs. So that's just one example that comes to mind.
Great. In interest of time, I'm going to go to the next question because we only have 3 minutes left. And this is addressed to Justin. It's from Amy. How is FEMA applying the equity analysis to its contractors as well? Thinking the first presentation of faith-based response, faith-based first responders, and the power FEMA might have to shift their policies to be more equitable.
Yeah, so I think that, you know, all that we do in this space is going to be defined by our strategic plan. That is going to be our doctrine, our ethos for how we advance equity. And the way we're looking at equity now is that equity doesn't live and exist within the walls of one agency, that it needs to be extended well beyond what we do here in Washington, D.C. And show up in other spaces and places, you know, whether that's contractors, whether that's our education programs with a lot of training institutes that train the future of emergency management and can be a really successful space to help bring new thinking and ideas. So we are looking very big at all of our the full extent of how this agency can help move the needle.
Great. Thank you so much. I just want to thank everyone again. Interest of time, I'm going to conclude, but thank you, Justin. Thank you, Kevin. Thank you, Vanessa and Leo. And especially thank you to ACSP Inclusion, the special interest group for LGBT planners and practitioners that hosted this very first fireside chat. The inclusion group will again have two to three more next year. So please watch out for those emails. And we're going to be doing various topics related to LGBTQ communities and urban planning, various aspects. And again, thank you to the University of California, Irvine, the School of Social Ecology for hosting and handling all the logistics of this presentation. So thank you. And please reach out to any of us, the panelists, if you have further questions. Thank you and have a great afternoon, everyone.